My name is Dr. Vladimir Baryev. I'm a general pediatrician specializing in autism spectrum disorder. And in this video, I would like to talk about the signs of autism. The signs of autism will depend on the age of your child. The earliest signs are when a child is missing important developmental milestones. One thing to note here, what is the difference between a sign and a symptom? A symptom is asking a child, how do you feel? And they'll tell you, I have pain. That's a symptom that they report about how they're feeling. A sign is something that someone can observe on their body. So you look at their skin. If they have a rash, you see the skin is red. That's a sign. That's something that anyone can observe from looking at the child. That's the difference between a sign and a symptom. Now, depending on the age of the child, we expect certain milestones to be reached, and when they are not, we begin to question if these are related to autism. The first one is by the age of 6 months, having very few or no big smiles or other warm, joyful, or engaging facial expressions. The second is having very limited or none at all eye contact, looking caregivers and others directly in the eyes. By 9 months of age, infant is having little or no back and forth sharing of sounds, sharing of smiles, or sharing of facial expressions, imitating them back and forth with another individual. By 12 months of age, if there is very little or no babbling, meaning making a consonant sound like g, b, k, m, not just vowels. So vowels would include e, oo, ah. Those are cooing. Babbling includes consonant noises, as I had explained earlier. Having very little or no back and forth gestures, such as pointing, showing, reaching, or waving, and having very little or no response to their name being called by 12 months of age. At 16 months old, if a child has very few or no words at all which they say. By 24 months of age, if they have very few or no meaningful two-word phrases putting two words together, which do not include imitating or repeating other people. And then, at any age of child development, if they lose previously acquired speech skills, babbling skills, or social skills, if they avoid eye contact no matter how much we try to engage in eye contact with them, if they're actively going away from it, if they prefer to constantly play on their own and not want to play with others, not even their caregivers, if they have difficulty understanding other people's feelings, if they have a significant delay of their language development, if there is a persistent repetition of words or phrases, we call this echolalia. If they are very resistant to very small changes in routines or surroundings, if they have very limited interests, a child who is only interested in playing with one particular type of item all of the time, as an example. If there are repetitive behaviors such as flapping of the hands, rocking, spinning, or etc. And if there is unusual or intense reaction to sounds, smells, tastes, textures, lights, and/or colors. None of these individual signs will diagnose a child with having autism. However, if they are present, should open up the possibility to consider them for digging further into what's going on with a child's development. If you learned something from this video, please hit the like and subscribe buttons below to help spread the word. For parents living in New York State, call my office at this number to ensure that your struggling child gets the right diagnosis and the help they need now.